at 10, Alabama is almost 4 months into its battle against the coronavirus. And tonight, the state is on the brink of 50,000 cases. So we wanted to see how staff at local hospitals are handling the surge in cases. WAAY 31's Will Robinson Smith is live outside of Huntsville Hospital. He spoke with doctors and nurses in Madison and Limestone counties about how things have changed these past few months and how you can help.
Well, Naja and Dan, just today, the Alabama Department of Public Health says there have been more than 6,700 people hospitalized for coronavirus across the state. Now, folks here and at Athens Limestone Hospital say they're doing what they can to help combat the virus, but they say there's plenty you at home can do to help them as well. After months of facing the pandemic, the medical staff at facilities like Athens Limestone Hospital say they feel better about facing the virus now than they did in the early days.
We are less scared than we were. We're more knowledgeable now, but we still are taking the precautions that we need to and treating them with the most excellent care we can provide.
ICU Tech James Root and registered nurse Meg Pickle took a brief pause from their 12-hour shift to share their experiences at the hospital. Pickle is dressed in part of her coronavirus personal protective equipment, nicknamed the bunny suit.
I pretty much get in this if I'm going to be working with COVID patients. I wear this all day. I don't leave the unit, and this is what we all wear, along with gloves and then, like I said, the N95 mask.
At Huntsville Hospital's main campus, Dr. Sherry Squires says over the past few months, she and her coworkers gained an appreciation for just how contagious the virus is, the various ways it can develop in patients, and the importance of both preparation and prevention, like wearing masks in public.
Masking and distancing and just using common sense can eradicate this thing, and yet it's still out there prevalent.
Dr. Squires was part of the medical team that crafted Madison County's mask ordinance. She says they had hoped creating a mandate wouldn't be necessary.
But more and more what we were seeing was, despite efforts to encourage people, it was still not being done out there as widely as we had hoped that it would be. So what we hope to do is put more pressure on people to do this and educate them in a more stern way.
And with the amount of work they're doing to make sure patients recover from the virus, folks like Root wish that people were doing more to help them.
It is frustrating, yes. Just to see the people not taking things seriously or thinking that this is something that's blown over already, wearing their mask.
Dr. Squires adds that while the Huntsville hospital system was very proactive about getting PPE, she and others in the medical field are still concerned for their own safety as they continue to confront the virus day after day.
We are concerned that if a lot of our colleagues get infected, that will deplete our resources at the hospital, so we all are trying to take care of each other.
And it's not just their physical health they're protecting, but their mental and emotional health as well.
We really lift each other up. I mean, when somebody's having a bad day, we really try to go above and beyond to make up for that weakness, which isn't a weakness, it's human,
And Root says that they certainly appreciate the signs of thanks that the community have been giving them, like the parades that have been thrown, but say that the best way that you can thank them is by doing your part to slow the spread of the virus, by doing things like wearing your mask and staying socially distant. Reporting live in Huntsville, Will Robinson Smith, WAAY 31 News.
Thank you, Will. Hospital staff says that they are also taking extra precautions to keep those who come into the hospital safe. And we want to remind you that anyone who needs to go to the hospital for non-coronavirus reasons is safe to do so.